working on your smile can really improve your confidence.
Yes.
So what dental procedures would you say generally improve people's confidence? Yes.
Top on the list is straight teeth, especially for young people, even adults.
Kill your confidence.
Exactly. It does really affect the confidence of people. And though they may say it doesn't, somebody will tell you, no, I don't care about the way my teeth are. But they have etched it in their subconscious. And slowly, without knowing, over time, one, they don't smile as much as they would like to. Their smile is always, they've learned to do it from many years. So
conditioned.
They've conditioned to that. They may be in a different position and everything, but it is there. Issues with public speaking, because they're thinking, what will people say about my teeth which are not well aligned? And therefore, teeth which are not straight definitely affects the confidence, the way you feel about yourself and the way you think other people feel about you. And sometimes can end up affecting, for children, I've seen it affect even performance in school. Kids can be very mean to each other.
Cruel.
Yes. I recently treated a boy about age 8, and these front teeth came in and they were in reverse bite. They were biting completely on the inside. Behind this one. So that means the other 2 teeth here were like this, but these 2 center are inside. So these 2 are like this. Oh my goodness. The mother told me, that child, literally, the other kids have almost destroyed him completely in his class. So we did what we call interceptive orthodontics, reversed this, and within a month, the confidence of the child I can't believe it. That's
through the roof.
Yes, through the roof. Many years ago, there was a girl, she was of Indian descent, When she came to me, her teeth were very crowded. She couldn't smile. She never opened her. You could not see her teeth at all. Yes.
Always.
Yeah. She was, and her hand also. Every time she spoke.
When she laughs.
Yes, she always covered with her hand.
Yeah.
And so hers was a long treatment. I think it took almost 2 years to.
How old was she?
She was a teenager.
Okay.
Yes, she was a teenager. Late primary school, or just began Form 1 there, early high school. And we walked the journey with her, and I watched her bloom over 2 years. I just saw her personality change, her confidence. We started seeing her teeth. By the time we were finishing the treatment, this girl was going to represent her school in the Kenya Science Congress something.
So you literally changed her life.
Yeah, she changed completely. This thing just... So now we were not discussing about teeth. She was coming to ask me questions on chemistry.
Wow.
And because on this project now, because she was going to represent her school in the National Science Congress Festival, whatever. So I just couldn't believe it. That is one girl I have never forgotten. I suspect she might be a doctor in India or UK or somewhere, or even here.
I mean, that sounds like the origin story, like where someone's like, this is the reason I became a...
Yes, yeah. Because before she couldn't do anything. After 2 years, she's so confident, she's representing the school.
Imagine that.
Yes.
Okay, other than straightening, is there any other procedure you would like
the other procedure would say, which affects confidence, is the color of the teeth, ranging from mild stains, brown, to all the way to whatever. And that's where now the treatment of dental fluorosis comes in, whether it's in the form of bleaching the teeth, in a layman's language, whitening the teeth, in whichever form we do, whether it is bleaching, masking, crowning the teeth. I think that little does affect the confidence, both for children and also for adults. The other one is untreated gum disease and untreated periodontal disease. And we know some of the symptoms would be accumulation of tartar. There would be sometimes bleeding and bad breath. If people know they don't have good breath, then you find that can affect their confidence. But why should somebody go through that in something that is actually manageable? Why should somebody endure that? But sometimes because of lack of knowledge and information, that's why we are doing these videos, to educate people. Then if you yourself, you perceive that, or you know your breath is not good, then just visit the dentist. And especially 90% of the issues with breath originate from the mouth. There is a small percentage where it may be coming from the throat, from the stomach. And if we eliminate everything in the mouth and still the problem continues, then we would either refer you first to an ENT surgeon to check the tonsils and that kind of thing. Then after that, to the gastro people to check, are you having gastric reflux or something like that? And those are things which can be managed. Yeah.
Yeah, probably just even to add to that, because you've given us three, I've just thought of one. Is and you mentioned this gap in the teeth.
Yes.
Yeah, some people feel uncomfortable with that.
With the gaps.
And I think it can also affect confidence. I don't know what you think.
Yeah, some people, when they have multiple gaps in the teeth, that also can affect their confidence. And it's good to know that if you're really not happy with those gaps, some people don't mind them and it doesn't affect them. But as time is going on, people don't want gaps in their teeth.
Mostly if there's a solution.
Yes, because there's a solution. Yeah, so they want those gaps closed, and it's easy. Yeah, using orthodontics, braces, it's easy to close those gaps. There's another thing which is quite common. If you walk around the street, you may notice people with just either one or two dark tooth or a grey tooth at the front of the mouth.
Yeah, I know what you're talking about.
Yes.
Mostly growing up, I used to see that.
Yes.
Yeah.
You know where that came from?
No.
That came from an injury when they were young.
To the tooth.
Especially the front, to right here, right at the front. You find somebody with a dark grey tooth. It's usually most likely from a sports injury in school, when they're in primary school or they're in high school. They had such an impact. They hit the tooth did not come out, but that impact affected the nerves and the blood vessels going into the tooth. So the tooth starts dying slowly. And then over time, it changes color. First it becomes gray, then it becomes dark, and over years, then it becomes quite dark. So you'll find somebody has got that gray tooth, dark tooth at the front, and sometimes it bothers some people and affects sometimes people's confidence. It is always good to know that something actually can be done. I just finished treating a young man this morning. Unfortunately, he's young. He's a teenager.
Why is that unfortunate?
Well, because he's so early in life. Yeah.
Okay.
Yeah. And they were playing basketball.
Okay.
And a friend of his just accidentally elbowed him and just knocked his two front teeth. And within about less than a month,
it already darkened.
The two teeth were completely dark.
It can move that quick?
Yes. Okay. For him, the impact, I think, was so... The injury was too great, was so severe that the teeth died and there was bleeding inside the tooth. Okay. So what happens is that red blood cells, the blood in the tooth, it's broken down into something called hemosiderin, and that hemosiderin now stains the tooth. So what we do is that for those two teeth, like for him, we do a root canal treatment, clean the teeth all the way from the inside, and then after you finish treating the tooth, we do what we call an internal bleaching. We bleach the tooth from the inside. Use a very concentrated solution. It takes 24 hours to bleach that tooth, and it becomes completely white. So like I started his treatment bleaching yesterday. Today in the morning he came.
White teeth.
The teeth were white after the root canal, and we removed the bleaching material, and that is it.
Also, the bleaching material is removable. You put it in there and then you remove it.
Yes, the hole you drill at the back of the tooth to do the root canal.
Okay.
Once you complete the root canal, you put that bleaching material from the inside, lock it there for about 24 hours.
Wow.
And then you come, it bleaches the tooth overnight.
Okay.
And yes.